Today we will be teaching you how to do a tracheostomy suctioning. For this procedure, you will need
normal saline, Germex, BVM, and we won't use the mask, sterile gloves, clean gloves, suction catheter, and a suction canister.
Step 2, turn the suction on between 80 and 120 mmHg. Attach the ambu bag to 100% oxygen from the piped-in oxygen. Enlist the assistance of another healthcare worker. Safety, it is very difficult to attach the ambu bag to the tracheostomy and squeeze the bag to hyperoxygenate the patient using only one hand, since your other hand will be sterile. Step 5. Put on the sterile gloves and prepare the sterile suctioning catheter and saline as you did in skill 28-6. Keeping in mind that your non-dominant hand is not sterile. Lubricate the suctioning catheter in the sterile saline as in skill 28-6. Have your assistant attach the ambu bag to the tracheostomy tubing and give the patient 3 to 5 breaths. Then disconnect it from the tracheostomy tube. If you have no assistant, you must do this while keeping your non-dominant hand sterile and holding the sterile suctioning catheter. Insert the catheter into the tracheostomy tube until you meet resistance, which is the carina of the trachea. Do not apply suction while inserting the catheter to prevent hypoxia. Apply suction with your thumb as you withdraw the catheter. Use a circular motion and rotate the catheter between your thumb and first finger as you withdraw it to ensure that you suction all areas inside the tracheostomy tube. Lift your thumb off the valve after a few seconds and then return it to the valve. This helps prevent the suctioning catheter from sticking against tracheal tissue and causing trauma to it. Perform suction quickly. Suctioning for longer than 10 seconds at a time can cause hypoxia. Rinse the suction catheter by placing it in the cup of the sterile saline and using your thumb on the valve to create suction. Repeat steps 9 to 12 as needed to clear the tracheostomy tube of secretions. Wait at least 30 seconds between suctionings to allow the patient to breathe easily. Reoxygenate with ambu bag between suctionings. Avoid suctioning for more than a total of 5 minutes to prevent fatigue, trauma, and hypoxia. It is a good idea to hold your breath while you are suctioning a patient with a tracheostomy, since this will remind you that the patient cannot breathe while the suction catheter is in the tracheostomy. Disconnect the suction catheter from the suction tubing. Hold the catheter in the palm of your non-dominant hand and remove the glove over the catheter. This contains the catheter for disposal and prevents contamination of the hands. Remove the glove from your non-dominant hand and wash or sanitize your hands to prevent cross-contamination.